you live in, those are actually the factors that impact how you move through the world. And so those are actually much, much, much more responsible for health than the things that we normally think of, like how often somebody goes to the doctor. For a lot of the things that we go to the doctor for, by the time we get to the doctor, it's already too late, right? The problem has already been there, it's already taken hold. So shifting our thinking from clinical care to social, economic, and environmental factors is the most important thing that I would want you to walk away from this presentation with. All right, so if you don't listen to anything else I say for this whole presentation, social, economic, and environmental factors are the most important things for health. So when we say social, economic, and environmental factors, what we're talking about are these, what some folks call indicators, like education, employment, income, community safety, housing and transit. These physical environment pieces are also part of that social, economic, and environmental factors. So I'm throwing this up here because that last slide that I showed you, that's prettier, this is adapted from the CDC, the Centers for Disease Control and Prevention, the main public health agency in the country. This one, so let me just point out, 55% is the number here at the bottom for those social, economic, and environmental factors. Right here, what you see is that those social and economic factors represent 40%, right? But you see environmental is a word that's missing there, and you see environment underneath is 10%. So this is done by the Robert Wood Johnson Foundation's County Health Rankings. And they have a different methodology for how they get there. The main point I just want to share is that if you add those two, you're still at 50%. So two different people approached this completely differently, and they arrived at the same basic conclusion, which is that most of our health is determined by these social, economic, and environmental factors. Does that make sense? Okay. So what's interesting about that is when you look at health in Tacoma and Pierce County, what you see is that you're going to have a hard time seeing this, so I'm just going to skip this slide. But the main point is that you're going to see big differences between different places, and we'll kind of get into how big those differences are and where they happen. But one of the interesting things when we talk about differences in places is that a lot of times folks like me will come and present data about how different these communities are, or how different this outcome is, and we won't really talk about why very much. And folks will kind of be left to figure out what the why is on their own. And when that happens, we all kind of come up with different answers, right? So when I talk about the inequities that we see, what I really want to focus on is the fact that these inequities are caused by systems and policies, right? It's not individual behaviors that are the main problem. It's systems and policies that actually lead to the way people have to live their lives, to survive. And so systems and policies often prioritize certain people and groups, which then creates inequitable foundations for health. We'll talk about some examples of what some of those are. I added the word unintentionally here because a lot of times we have a tendency to think that there are bad people behind the scenes making decisions to hurt other people. And perhaps that's true in some cases, but in a lot of cases, it's well-intentioned people making policies that have unintentional consequences for different people. So I tell myself that to not let myself off the hook, right? I know I have good intentions as I'm working on these issues, but I don't know everything about everyone, and so I'm going to make assumptions as I'm thinking about things. As you know, as a straight male, you know, who has some privileges, I make assumptions about things that maybe somebody who didn't have some of my privileges wouldn't make. All right, this is hard to see, it looks like. So this is a map of Pierce County, and it's broken into census tracts. And you'll see that each census tract is in a different color. So the green colors mean that folks in that area have long life expectancies. All right, so the darkest green means the longest life expectancy, with the exception of JBLM. That's a data glitch right there. The red areas have the lowest life expectancy. basically the worst health outcomes, okay? And you can't really see the numbers, but the dark green areas have life expectancies of 84 years or above, and the red areas have life expectancies of 73 years or below. So here in Pierce County, there are areas that you can go. You can take a 5-minute drive here and go from an area that has a life expectancy in the high 80s to a place where people can expect to live 15 to 20 years less. That's a huge difference. That is a really, really, really big difference. So that's a pretty stark data point for us at the health department to recognize that there are some people in our county that are living such a shorter amount of time. And chances are that those folks are also living a poor quality of life while they are alive as well. And so the why becomes really important. Here's the problem, right? Here's the problem. Now, why is this happening? So this brings us back to policies and systems that affect social, economic, and environmental outcomes. This is the same map of life expectancy, but you'll see there are dots on top of those colors. Those dots represent poverty. So the larger the dot is, the higher the percentage of folks that are living in poverty in that area. And the general pattern that you see here is that more often than not, the more poverty that there is, the lower life expectancy is. The less poverty there is, the higher life expectancy is. Do you all see that pattern as well? Mm-hmm. So this is the most updated data. I actually just pulled this yesterday to make sure I had the most updated data for this meeting. And this is the same life expectancy map with a couple of extra years of data put on top of it. What you see here is that that general pattern still holds true. And if you go down the I-5 corridor, that tends to be where we have our worst health outcomes in Pierce County. It just so happens that the areas that you all are focusing on happen to be some of those areas, right? So you see how dark red the west side of South Tacoma off I-5 is right here, right? So that has some of the lowest life expectancy in Pierce County. It looks, based on the data, like the other side of the highway doesn't have as bad of outcomes. But any one data point doesn't give you the full picture, right? So I'm always hesitant to say, well, that's not as big of a problem, because different pieces of data you can look at are going to give you a different story. In general, South Tacoma has fairly bad health outcomes, though, as you can see from the map. Now, when I said that systems prioritize certain people, if we try to answer the question of why outcomes are so different today, we can often jump to the individual behaviors of families that we're looking at, right? Like, why do these parents do this thing that's not healthy for their children? Why do they do this thing for themselves? Why do they smoke? Why do they drink? Blah, 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 right? When we look at why communities have developed in the way that they have here in Tacoma, we gotta go back and start talking about, like, how did people come to Tacoma? Where were they living when they came here? What was that like? And so when we talk about racial inequities, right, that's one of the big inequities here in Tacoma, is that when we look at these health data by race, we also see there are significant racial inequities. And so again, why is that? So this is a map from Tacoma from 1937, and this was put out by the Federal Housing Administration. Anybody familiar with the term redlining, residential redlining? Okay. So for those of you that are not familiar, in 1937, the Federal Housing Administration was created as a way to try to improve investment opportunities for housing. And this was kind of when the housing market really redeveloped. Now, at the same time, you got to remember, 1937 was not a very racially sensitive time, and so when they were thinking about how do we make investments smarter, they thought about, well, we should put out a system where every neighborhood is given a grade to let people know what kind of investment strength this neighborhood should have, right? Which makes kind of some sense, doesn't it? If you were an investor and you wanted to know, like, where to put your money, wouldn't it be great to have a guide? Like, you probably want to invest in this area because it's secure, safe, low risk, right? One of the factors that led to how they graded these neighborhoods was race. At that time, it was basically considered a fact that a homogeneous neighborhood or an all-white neighborhood was a more secure investment than a neighborhood that had people of color in it. And so one of the factors that actually led to the different grades was how many people of color lived in that neighborhood. All right? So in 1937, this was the map that was produced here in Tacoma. And this was done in partnership with the Realtors Association of Tacoma and all these other folks that were sort of involved in the housing market. So this was by us, for us here in Tacoma, basically. And what you see here is that the same colors are used, right? Where red is basically bad, the lowest grade, and green is the highest grade. What do you notice about this map?
Similar.
Everything that's north looks good, for the most part, all right?
Not much has changed.
Not much has changed, right? What year did I say this was from? 1937?
Mm-hmm.
Okay, so that's about 80 years ago now. So what's interesting is that if you look at the red areas, and by the way, you can see that much of like the west side, the Fircrest, UP, Narrows areas aren't even showing up here. This was 1937, so those actually weren't even developed yet. A lot of that was still farmland. So what you see here is that Hilltop, East Side, and South Tacoma were kind of singled out as areas that were low grade, right? And so what's interesting is, do you all notice the small little red square in the top that's kind of nestled in better rated areas? There are descriptions that go along with each of these areas, and we pulled some of the descriptions, and that top area is the one on the bottom, D1. And so you can see the clarifying remarks there for D1 are that 3 highly respected Negro families own homes and live in the middle block of this area facing Verde Street. While very much above the average of their race, it is quite generally recognized by realtors that their presence seriously detracts from the desirability of their immediate neighborhood. Okay? So what's interesting to me is that, the American dream of sort of picking your family up, moving them to a better neighborhood, and providing them better opportunities was not necessarily an option for everybody, because their presence was what actually downgraded the neighborhood. So how can I move my family to a better neighborhood if my presence is what detracts it, even if I am a more highly respected family than was generally accepted for my race? So this is not so distant in the past. And what's interesting to me is I just moved to this area 4 years ago, and when I started learning about the community, I came from the East Coast, which the history is a little bit longer, right? But you can actually reach out and touch the history here in the form of people, in the form of some of the things you see. Like the fact that Hilltop, it was known as the black neighborhood in Tacoma. This map sort of shows you why, right? Do you all know when most African Americans came to Tacoma? World War II, right? A lot of GIs that were discharged afterwards ended up staying here, just setting up shop. So imagine that you're a GI, you just fought for your country, you come back, you're discharged, the GI Bill is beginning to be offered. And this was like a major policy that created the middle class in America. 99+% of GI Bill benefits went to white GIs, okay? And so the GI Bill is largely responsible for the home ownership changes in the United States. I'm personally half black, half white, and the white side of my family, my grandfather served in World War II, and he used the GI Bill to purchase their first family home that my mom grew up in. So I've seen sort of how much of a step into the middle class that is, because my mom grew up very middle class, and I think that's probably why I got a lot of the opportunities I got. Most black GIs did not have that opportunity. So on top of that, on top of not having that pathway to home ownership, they were also funneled into these red areas, right? So think about it, as a person living in a green area, as a realtor, you are either consciously or subconsciously not taking people of color into these neighborhoods that are green or blue for a number of reasons, right? So this is why we see the racially segregated housing that we have in Tacoma, why we still have images that come to mind when we say the North End or Hilltop. This is part of the history of how we got there. And so when I say systems and policies impact where people, how people experience health, this is why. And so if we play this out further, the areas that are determined to be good investments have more businesses, have more infrastructure investment, and the housing values continue to rise at a faster pace. So think about two houses that are similarly valued in 1937 in Hilltop and on the North End. Do you think they're similarly valued today? So, in addition to that, how do we fund education? Property taxes, which are based on what?
Value.
Values. So you can see that as we tell ourselves that education is the stepping stone into the middle class, we're also sabotaging that notion of the American dream by building it on top of an already inequitable foundation. So how this plays out for health is that racially, when we look at health outcomes in Tacoma, there are certain groups that have far worse health outcomes. And the three that really pop out in my mind are African Americans, Pacific Islanders, and Native Americans. And if you think about the similarities in the histories of those communities, right, there are a lot of similarities that you could extrapolate into why do we see certain health behaviors? Why do these groups smoke cigarettes more often? Why do these groups eat unhealthier foods more often? Is it because they don't have the right health education? No, probably not. It's because they live in neighborhoods where they don't have access to certain resources. It's because they have been forced to sort of accommodate these behaviors within their culture because of what was available to them. And then we sort of wonder why do we keep seeing these inequitable outcomes? It's based on these same root causes around inequitable opportunities. So let me switch gears and talk about South Tacoma specifically. I just wanted to call out mental health for a second because I know that's a huge issue here. I know for those of you that are working in schools, that's something that you're dealing with all the time. It's a problem here, and we all know that, especially those of us that are sort of touching folks on the ground. And what I just want to call out is that the major inequity here is around income. That when we look at data around mental health among adults, the group that really far and above is suffering from this burden of mental health are folks making less than $25,000 a year. And there's a number of reasons for that, but one of the reasons is think about the factors that lead to a behavioral health crisis. It's issues of stress being piled on top of themselves until something has to break. Does that make sense? So I feel pretty stressed in my life. I have 2 young kids, and I gotta manage, taking my wife to work and dropping my kids off at preschool and coming to work on time, and all of that's stressful, and I'm super privileged, right? Like I have a car that works pretty well, and I have enough money that if it breaks down, I know I'm gonna be okay, and I know that I'm gonna have food on the table for them when we get home from, all of this stuff I have going for me, and still life's stressful. So what is it like when every day you're dealing with the fact that if you miss one more day of work, your boss is going to fire you and you have a sick child? Or you feel unsafe with your kids walking to school because of the neighborhood that you live in, but if you don't let them walk, you're going to be late for work. Like, what does it feel like to have to deal with those stresses every day? Knowing that you're not going to have enough money to pay for rent. Knowing that your family might get displaced. Knowing that you might have to live in your car for a couple weeks until you find out what the next thing is. Like, I can only imagine what that feels like to deal with that day in and day out and not have an escape from that. When I have a stressful day, I get to have escapes. I get to go home in my comfy house and I get to escape from that for a couple hours. A lot of people have zero escape, and so that is a contributing factor to some behavioral health issues for sure. When we look at poor mental health by geography, you guys see where Tacoma sort of sticks out for poor mental health outcomes. Seems to be the 253 impact zone. When we look at mortality from cardiovascular disease, these are heart issues, heart attacks and things like that. Again, this area sort of pops out as being a particular issue. When we look at low birth weight, these are babies that are born either premature or underweight. We see again that this area has really bad outcomes. And by the way, stress is one of the main factors that leads to poor birth outcomes like this, maternal stress. So one of the things that I did is, you can see that those are just a couple data points. I showed you mental health, cardiovascular disease, what was the last one? Low birth weight. There are about 60 different indicators that I've mapped out like this. And for some of them, South Tacoma doesn't look that bad. So what I did was I took 10 of the biggest indicators that actually lead to outcomes like life expectancy and averaged them out across those different areas. And so what that did was create sort of a cumulative health risk score, right? If you have bad cardiovascular outcomes, but you're really good in everything else, then that probably means that you're not as high of a risk area as a place that has 9 bad outcomes and 1 good one, if that makes sense. And so when you average them out, here are the highest health risk zip codes in Pierce County. You can see up there at the top, it's kind of the Tillicum, Woodbrook, Springbrook, Lakewood stretch. And then you have a couple of other smaller places. And when you get to Tacoma, you see that 98409 and 98408 are both in the top 10, right? And those are the 2 main zip codes that you all are focusing on. I have the east side here as 98408, but as you guys know, it sort of splits both. Now, why this is so important is that as a government agency, we have limited resources, and there's only so much we can do. And typically what we try to do is we try to do everything for everyone. But what ends up happening when you try to do everything for everyone is the people that already are the least affected but have the most ability to access resources are the ones that get the most, right? And so this was an exercise in trying to figure out where should we focus our energy, right? There are folks in Pierce County that if the health department interacts with very, very little or none at all, they're going to be okay. And there are other folks that that's not the case. So where are we focusing our energy? This is kind of what has started leading us down the road of identifying what these communities of focus are for us. Now, because 98404 and 98408 are both touching each other, and they have really large populations, and you all know there's a lot of stuff going on the east side right now, that was a community that we focused on for this past year, and Connie has been sort of privy to that process as part of our Board of Health. But you can see that there's a significant need in South Tacoma as well. And so we are looking at South Tacoma. We're participating in events like this to make sure that we're staying engaged with South Tacoma and figuring out, well, what are the needs of South Tacoma that aren't being met. So we're happy to sort of be with you guys in this process and figure this out together. So if you're interested, this kind of data is all compiled into a report called the 2015 Health Equity Assessment. I put our website down there at the bottom if you're interested. I will warn you, it's like 80 pages, and it goes in depth into each of these different areas about what's the issue, what are the inequities, how are they playing out geographically or racially or gender-wise. And so that's what we're basing a lot of this off of, is this data and this report. Now, before we jump into discussion, real quick, there's a couple of things that we feel very strongly we should do about it. So I just gave you the background. Now, where do we go from here? So if systems and policies are most responsible for these big social and economic outcomes, then systems and policies have to be shifted. And so one of our priorities is something called health in all policies. And it's just like it sounds. It's the notion that health should be a consideration in all policies, right? If housing is a huge indicator of health, then housing policy should consider health outcomes, right? If transportation is a big factor for health, then transportation policies should consider health. Does that make sense? So we're actually right now working with the city of Tacoma on figuring out how to make this real for them. But essentially, if those are your policy wonks, there's a policy note that goes, basically it's a memo form that goes to council members when they're in session. And at the bottom of that memo, there's a fiscal note that basically calls out how much this policy is going to cost over X number of years, right? If there were a health note or a health and equity note that sort of called out what the health impacts or equity impacts of that policy were as well, how would that change the decisions that get made? Maybe it wouldn't change all of them, but would it change some of them? Mm-hmm. Perhaps. And so we think that those social and economic and environmental policies are actually going to have a bigger impact on changing health outcomes than any program or service or hospital improvement or anything like that. Until housing, transportation, food, it's like Maslow's hierarchy, right? If people don't have their basic needs, you teaching them how to cook healthy food is not going to be effective. It's just not. I work at the health department, this is my life, and yet I make decisions that are not very healthy sometimes because they're convenient, right? So it's not just about knowledge and, knowing what the right thing to do is. Is it convenient for you? Is it going to work? Right? Like if I get off of my second shift of the day at 7 o'clock and I get my kids and I'm going home and I'm really tired, am I going to spend an hour cooking to have healthy food, or am I going to stop at KFC because that's one of the only places in my neighborhood? Personally, I make that stop at KFC sometimes, and I'm not ashamed of it because that's what I have to do to make it that day. And my kids eat, right? So unless those policies make healthy decisions convenient for people, then it's not really going to work. So health in all policies is the policy level thing. The second thing that I really wanted to call out was something called participatory budgeting. How many of you have heard of that before? Not very many people, okay. So participatory budgeting is really hard to say without sounding like you're drunk. It's like the word judicial. That's hard to say without sounding like you're drunk too. Participatory budgeting is basically where you shift the power of the decision from a government and to the actual people that are going to be impacted by the decision. So people participate in the budgeting. So an example of this would be, I'll give you guys a real life example. So we worked with Pierce County Parks for the past couple months around Dawson Playfield, which is on 90th and Portland. They have this tennis court there, it has a huge crack in it because there are water issues at the park, and they had their capital budget to redo the tennis court. They had $100,000 to redo this tennis court, okay? I don't know if you guys have ever been to 90th and Portland. Mm-hmm. I have not heard of anybody playing tennis there. And so I gave a similar presentation like this to the Parks Department, and afterwards they sort of started talking to me about this project, and I said, how hard would it be to let the people that live there decide what to do with that money? And they said, we're not sure. And I said, can the health department partner with you and facilitate a process to see what happens? And they agreed. And so what we did was we went out to the park a couple weeks ago, and we basically got ideas from people, right? People that were in the park just playing, hey, what would you guys like to see happen with that tennis court area? And some folks would come, it would be great if we had this thing or that thing. And we worked with them to figure out what actually were you asking for. So this past Saturday, we went back out there and had a vote in the park day. We created basically voting options based on the proposals that community members had made before. So kids had asked for a new playground, so we had a playground proposal, right? And so everybody that showed up at the park, and we did a lot of organizing to try to get people out to the park and do things like that, working with the senior assisted living center next door where people come and walk there, making sure, trying to get everybody involved. We got 237 people to vote. which is a huge turnout.
That is good.
And of the 7 options, a spray park is the option that ended up winning. Which Parks wasn't thrilled about because it's going to take longer and cost more, but that's what people wanted, right? And if our goal is that people use the park, what should we be doing? We probably shouldn't be making decisions based on how cost effective they are. We should be making decisions based on, do we get to our goal? And do we have enough money to get to our goal? So anyway, the spray park won, and the tennis court had the fewest amounts of votes. Had 4 votes total, the tennis court. So I feel really, really strongly that even when we think we're doing the right thing, this tennis court is broken, we should repave it. That may not be the right thing. And so the more opportunities we have to push the decision making into the end user's hands, the better the outcomes are going to be.